Hello. Today we will talk about sinus infections. So, first of all, we will get rid of the terminology. And there are two different terms that are important to distinguish between two different entities. Those are rhinitis and sinusitis. So, first of all, rhinitis and secondary sinusitis. So the first term, rhinitis, actually is the inflammation of the nasal mucosa. So in our nasal cavity, the nasal cavity is lined with an inner lining called the mucosa. Once there is an inflammation in this inner lining, we can call this rhinitis. But once the inflammation is present in the sinus cavities, so the sinus cavities, they all have also the inner lining that is the mucosa. Once the mucosa in the sinuses is inflamed, then we call this sinusitis. But often, in order for the mucosa in the sinus to get inflamed, the pollutants, the allergens, the pathogens come through the nose and infect also parts of the nasal mucosa. There is a term for the infection at the same time of the nasal and of the sinus mucosa called rhinosinusitis. So sometimes people that talk about sinus infections will also talk about rhinosinusitis because sometimes it's also hard to distinguish is or is it not only as infection in the sinuses or is there involvement of the nasal mucosa. When it comes to rhinitis, rhinitis can be distinguished easily from these two terms. Sinus infections are more problematic than rhinitis or the inflammation of the nasal mucosa in most of the cases. In most of the cases, rhinitis is just a viral infection and an inflammation of the nasal mucosa. You have a runny nose for a few days and it is a self-limiting condition. But infection of the sinuses is a more complicated story. So basically, for this tutorial, for this lecture, we need to know that rhinitis is an infection of the an inflammation of the mucosa of the nasal cavity, and sinusitis is a more complicated inflammation that also develops in the sinuses, and sometimes it is also called rhinosinusitis, depending on how prominent and how big the inflammation in the nasal cavity and the sinuses is. Because the sinuses are not called parasinuses because just for story, they are called parasinuses because they are located on the lateral sides of the nasal cavity and they are connected with the nasal cavity. So to recap a little bit of anatomy, so we have four parasinuses structures. The biggest one of them is the maxillary sinus. So this one here. So it is the maxillary sinus. Or in Latin, it is called sinus maxillaris. Sinus. So this is the first one. The second one is the ethmoid sinus, or it is not as the maxillary sinus. The maxillary sinus is a big one, but in the case of the ethmoid sinus, it is actually more smaller ones, and because of that, they are called ethmoid cells. So ethmoid cells, or the ethmoid labyrinth, or in Latin cellulae or cellulae ethmoidales. Then we have the frontal sinus. So the frontal sinus, or in Latin sinus frontalis. The last one is actually in the sphenoid bone. It is called the sphenoid sinus. Or in Latin, sinus sphenoidalis. So these are actually the sinuses, and they are called parasinuses because they are located on the lateral side of the nasal cavity. So para meaning lateral, nasal, paranasal sinuses on the lateral sides of the nasal cavity. So that is why they are called paranasal sinuses. So these are the structures that are involved, or better to say their mucosa in the first acts is involved in sinus infections. So now once we looked at the anatomy, we will look a bit at the function. So there are many functions of these sinuses. They are actually air-filled spaces in the head, so they lower the mass of the head. They are also shock absorbers and so on. But one of the big function of the sinuses is actually air conditioning. So as the air passes through the nasal cavity, it doesn't pass in a straight line like this. It actually enters the sinuses, it makes vortices, and in that makes the time for the air to travel to the lower parts of the respiratory system. It takes more time for the air to travel through this area. And in this time, the air gets conditioned so it doesn't get too cold or too dry into our lower respiratory system. So the sinuses humidify the air so it isn't too dry. They are warming up the outside air so it isn't too cold, and they are filtrating it so that big particles don't go into the lower respiratory system. So the air is conditioned in the nasal cavity and in the sinuses for our lower respiratory tract. That is the big function of the sinuses. Now, what is, if we're talking about sinusitis and sinus infections, what is the etiology? So intranasal cavity, of course, it is not just with the air. Many things come in, different pollutants, different allergens. There is also a possibility for trauma. So if we have head trauma and that leads to an opening to the sinus, of course, outside bacteria can enter the sinus. If we had, for example, a tooth here, and if the tooth was inflamed, an infection could go to the sinus. Outside, viruses and bacteria can cause rhinitis and then later sinusitis, especially if there's some predisposing condition. For example, if the person has a lower immune system capacity, if for example people who take corticosteroids, who have diabetes, or people that have constant infections here in the sinuses because they are constantly in some air polluted area. When we come to infectious etiologies, they are mostly viruses. But those conditions are self-limiting. So when we talk about viral pathogens, rhinoviruses, they mostly infect the nasal mucosa. but sometimes they can spread to sinuses and give some symptoms of sinusitis. Then also these viral infections in the nasal cavity can injure the mucosa and the local immune system and predispose for bacterial infections. So these bacterial infections, they can cause sinusitis that gives those classic symptoms of sinusitis. We will talk about them a little bit later. And of course, there is a possibility for people that have a damaged immune system. They can develop fungal infections, but they are more rare than, of course, virus and bacterial pathogen infections of the nasal cavity and sinuses. Now, when we talk about symptoms, we saw that a runny nose and feeling a little bit ill is a symptom of a simple viral rhinitis. In the case of sinusitis, this gets more complicated and symptoms are more pronounced. So one of the symptoms is a headache. A headache. So why do headaches happen? So once the sinuses clog up, they mostly cause a headache in their area, but they can cause different types of headaches. Also, people can feel a dull pressure when the sinus clogs up because of the mucus and infection. There can be dull pressure in the area of infection. Also, if it is severe, people can feel pain over the sinus. And also, for example, if the maxillary sinus is infected, the area of the face can swell up. So this part of the face could be visibly swollen, and it could be also a little bit tender, red, and warmer than the side that is not affected. Because if the infection develops here, there will be an immune reaction, and it will cause all these different symptoms. So when the sinus opens, when this infection discharges, so this mucus and pus that has built up, people can have different nasal discharge. So with pus or with blood. If these sinus infections last for longer amounts of time, there can be damage to different structures. For example, the olfactory epithelium that is somewhere here near the sphenoid sinus, and people can have a damage to their sense of smell that is called hyposmia, or if they lose their sense of smell, anosmia. So there can also be symptoms like ear fullness, bad breath, and so on. So you see that sinus infections have more symptoms than a simple rhinitis, and there are also more severe conditions than a simple rhinitis. So in order to distinguish between an acute infection, so an acute sinusitis, and a chronic sinusitis, there are some different classifications and criteria, but we will explain the difference between acute and chronic and subacute and some other forms. So first of all, an acute sinusitis. So the symptoms that I explained just now, if they last up to 4 weeks, so no longer than 4 weeks, this is called acute sinusitis. If the symptoms last more than 4 weeks, it is called subacute. So between 4 weeks and 12 weeks, it is called subacute. So those symptoms that I explained of sinus infection, they are like that in acute sinusitis, but in subacute they get a little bit, they are not so prominent like in the acute phase. And people are saying that subacute sinusitis, where we have symptoms but they are not so pronounced, so milder, it's just a transitional phase to chronic sinusitis that lasts more than 12 weeks. So in chronic sinusitis, we have some mild symptoms, but they're not going away. They're always staying there, and sometimes this chronic sinusitis can get exacerbated, and that is called an acute exacerbation of chronic sinusitis. So in this acute exacerbation, people have always some kind of mild symptoms, some mild headache, some mild runny nose, some mild cough, some mild discharge, but after some time, they develop symptoms like acute sinusitis, and then they take some antibiotics, it gets better, but it never goes away fully. In acute sinusitis, once the people take antibiotics, it goes away fully, and it is a solved problem. There is also another term when we discuss acute sinusitis that is called recurrent acute sinusitis. This term we use when the patient has 4 or more episodes of sinusitis in 1 year. So in these cases, it is easier to develop chronic sinusitis because of the chronic infections that are recurrent. It can go in subacute and then into chronic. And of course, people that are in a polluted area or where there are many allergens or many pathogens can easier develop more sinus infections in 1 year than people who live, for example, somewhere where the air is cleaner. So this is something where we would also explain the pathophysiology. So as I said, rhinitis is an infection of the mucosa of our nasal cavity. Our paranasal sinuses in acute sinusitis can get affected through the nose. So once the pathogen, a virus, enters the nose and causes rhinitis, damages the nasal mucosa, it is possible for some inflammation to develop, for example, in the maxillary sinus, in the frontal sinus, in the ethmoid sinus, sinus cells, in the sphenoid sinus. And then we would have also not just a runny nose, but all those other symptoms: headache, nasal congestion, dull pain, pain over the sinus, edema over the sinus location, a discharge with pus or just simple discharge, some kind of cough. Cough happens because once this infection happens in our sinuses, the sinuses, all of our sinuses are actually opening up into the nasal cavity. This mucosa produces mucus. The mucus is led away via cells in the mucosa that have hair-like projections, and these hair-like projections lead the mucus away into the nasal cavity and then down into we swallow them up. Once a pathogen enters, the mucosa tries to shield itself by producing more mucus. If more mucus is produced, these canals and openings, so the openings, for example, this is a small opening of the maxillary sinus. These openings are called ostiums. So an ostium is a little opening where the mucus is discharging. It is normally 3 to 4 millimeters in diameter. If we have an infection, more mucus production. So this would in the first phase be asymptomatic. So we have some pathogen or some pollutant that is causing a small inflammation of the mucosa. The mucosa produces more mucus, and the mucus starts clogging up because it can't be eliminated that fast, these openings. Once the opening gets less than 2.5 millimeter in diameter, that is a predisposition for infection, because all that mucus that is clogging up, it is a good medium for bacteria to infect. And then we would have a bacteria and pathogen that are always present entering, and they would have an easier time infecting our sinuses. Once the sinus is infected with a bacteria, unclassic inflammation develops. In the first part of the inflammation, if the ostium is clogged up, there will be no discharge. But as pus is, as the immune reaction happens, and as pus is building up in our sinuses, it can happen that the pressure builds so much up that it opens up this ostium, and so we could have discharge. If the discharge happens out of the nose, we will see it. If it happens into the back of our throat, we will have a cough, and we will have bad breath, or fetor exora, as it is called in Latin. So that is the pathophysiology of an acute development. Then we take antibiotics, and we do some rest, hydration, also warm showers, warm steamy showers, and we solve the acute, and we go out of the polluted area, and we solve the acute infection. But in the chronic setting, there is something called biofilm. So in biofilm, it is a protective layer. So if the infection happens, mucus develops, some bacteria can create this biofilm. It's like a house where the bacteria are protected, and antibiotics in our immune system can't damage them easily in this biofilm. And then once the bacteria sense, I will say it like that there is a good environment for development, this acute exacerbation happens. We take antibiotics, they die down a little bit, and there are only mild symptoms. But once a few months pass, they build up enough number of bacteria to cause another acute exacerbation. So that is how the pathophysiology works. When it comes to diagnosis, of course, the main focus in diagnosis of everything in medicine is anamnesis, so history taking, and a good clinical examination. With those two, we can it can lead us to therapy. So a headache doesn't need to be sinusitis. It can be just a tension headache or a migraine. So it is important to take a good history and clinical examination. Also, paranasal sinus x-rays. So we can take x-rays and see how the area looks. Also, endoscopic examination can give us some insight in how the nasal cavity and sinuses look. I will emphasize that this is very important in simple cases. If the cases are complicated, we need to go to imaging diagnostics like CT. For complicated cases, chronic cases, and where surgery, endoscopic or classic surgery is needed, CT is the golden standard for visualizing the paranasal sinuses. Also, we can do MRIs. When it comes to treatment, so many of these, any condition in medicine and also sinus conditions, when we talk about treatment, can be treated conservatively. So we are talking about rest, hydration, and antibiotics and other antipyretic medicine and so on, and surgery. When it comes to the conservative treatment, most of the simple sinus infections are solved with antibiotic treatment. And when it comes to complicated infections, we need to do therapy, we first need to know what is causing the problem, and then the therapy can be a combination of antibiotics and minimally invasive endoscopic surgery, or surgery that is more classic, more opens the structures up more, but it is more aggressive. Thank you for listening. This was an overview of some important ideas about sinus infections.